This is the One Thing Podcast, and I'm your host, Dr. Adam Rindy. The One Thing Podcast brings together leaders in functional and naturopathic medicine to discuss actionable information that may unlock puzzles in the areas of gut health, brain health, metabolism, and longevity. Please note, these episodes do not replace the opinion of your doctor. They are not intended to diagnose or treat any condition. Please discuss this information with your provider and discuss your own unique personal health history before adapting this information. Please subscribe to our episodes so that you can stay on top of the most current information in these areas of medicine. And now to today's episode. Estrogen problems may be linked to symptoms of bloating, constipation, menstrual irregularities, weight gain, low libido, and also conditions like PMS, acne, endometriosis, polycystic ovarian syndrome, and breast cancer. The link may be explained by the Estrobolome, which was first mentioned in 2011 by Plottel and Blaser as the aggregate of enteric, meaning gut, bacterial genes whose products are capable of metabolizing estrogen. Simply put, some bacteria in the gut may be causing increased estrogens to recirculate into our blood instead of being eliminated. Obviously, if this is going on, it's not so great. In this episode, I welcome one of the leaders in hormone health, Dr. Carrie Jones. Dr. Carrie Jones is an internationally recognized speaker, consultant, and educator on the topic of women's health and hormones. In this episode, Dr. Jones is going to speak with us about the estrobolome, what it is, how it's measured, and what we can do about it to make sure it's balanced. So without further delay, I welcome our guest, Dr. Carrie Jones. Dr. Jones, welcome to the One Thing Podcast. It's great to have you on today.
Oh my gosh, thank you so much. I really appreciate the invite and, of course, talking about my favorite topics. So this will be great.
Yes, yeah, it's you're welcome. It's really good to speak with you. I want to first just send a big thank you for all that you've done for not only patients, but also us providers with all the great education that you're providing with what you do. I think I've taken 3 continuing education courses from you, and I've learned a lot, and you're doing so much, and you're very generous with your knowledge. So thank you.
Oh, thanks. I appreciate that. Yeah, education is it's fun. It's the one thing. It's the one thing I really try to do with my social media or on podcasts or in webinars. So I'm really happy to continue that here.
Excellent. Yeah, so I've never actually heard what was the kind of key for you getting into endocrinology and hormone health. Like, who are some of the mentors and some of the background you had that kind of led you into this space?
Man, that's such a good question. So I've always known that I wanted to go into women's health. And once I figured out specifically I wanted to be a naturopathic doctor in school, my mentor was Dr. Kimberly Winstar, and she was one of the big women's health experts in the naturopathic school. And I loved what I was learning so much. And hormones are hard, but it came relatively easy to me. And it was something that everybody struggles with in some point in their life, men or male or female, it doesn't matter. And so I did my residency in hormones and endocrinology, and then continued on from there with my learning and conferences that I took and books that I read and research articles. And I obviously did. I mean, I incorporate, of course, gut health and the thyroid but I never went into. My friends would go into heavy metals, and I had friends that would go into regenerative medicine and for injections, and I had friends that went into aesthetics, and I had friends that delivered babies, and I just stuck to my lane.
Mm-hmm.
Hormones is what I know, and that's what I do.
Mm-hmm. And so, like Dr. Winstar, did she have a specific teaching style that worked for you?
She's just an incredibly generous person who loved to educate, and she really was just very empathetic. She taught me very early on, like, how to hold space for a patient, and how to hold space for yourself as a practitioner. She had a very successful clinic, and I thought, why reinvent the wheel? I'm just going to literally do everything that she does, because she was teaching, right? She was teaching it to us.
Mm-hmm.
So I took copious amount of notes, and I learned how to sit with a patient and really listen. She was a really good listener. She was, really all about the story. And like I said, she could just really hold space for a person if they were breaking down, if they were crying, if they were angry, if they were suicidal. And so I got to see a lot of emotion in patients. And when I graduated, even though I was new, I wasn't afraid. And I knew that when I worked with primarily women primarily who came to see me, that I could, a lot of health, a lot of hormones is listening and just listening and holding space and hearing their story, and validating, like, yeah, you're not crazy, it's not in your head, this is actually going on. And it makes such a huge difference, when you're working with hormones and women are telling you all their symptoms. And I think by learning that early on with Dr. Winstar, that's what got me, um, really into it, and I've stuck with it this whole time.
Well, that makes sense. I mean, there's so many elements to the hormone intake, and no two people are alike. So that makes sense that that was a skill and a modeling that really, really influenced you.
Yeah, it's funny. I would joke that I like gossip, and I don't mean it in the, like, lower level sense. I mean it in the, like, when women would come in and they would go, "I can't sleep and I'm so stressed out." I Most conventional practitioners would go, "Okay, here's Ambien and here's an antidepressant, check, good luck."
Yeah.
And I was like, "Well, why can't you like, why are you so stressed out? What's going on?" And then I'd want to know, like, what's going on in your relationship and what's going on with your job and what's going on with, how you feel. And and I became, I had more patients say to me, I'd rather come see you than a counselor or therapist or psychologist or something. They're like, "You actually I just feel better when I talk to you, and then we have actionable items at the end when I talk to you, and you actually listen."
Hmm.
And again, I think just because I appreciate that about I appreciate people's story. I mean, I call it gossip, but but then I got to know them and I got to know their family and I could check back in with them. And when I would see them again, I would go, "Oh, how's that thing? And how was that, stress or that vacation or that boss, or
Yeah.
how's marriage counseling going?" And then they were like, "Oh, let me tell you the rest." And sometimes that's all you need when it comes to hormones.
Yeah. Yeah. It's like to have that platform to be able to share some things that maybe nobody will even be able to talk about with anybody else. It's really great.
Mhm.
So
Mhm.
the topic we're speaking about today, or we wanted to kind of go through, is the estrobolome. And can you sort of tell us a little bit about this and why it's so important for us to look at?
It's a combination of two words. So the estrobolome is the estrogen microbiome, and then you squish it together and it becomes estrobolome, which we were saying prior to this. It's my favorite word in science right now because it's just fun to say. But it's the part of the gut, it's the part of the microbiome that handles whether or not you're going to reabsorb your estrogen and other hormones, but estrogen into your body. So if you are a man or a woman and you are done with an estrogen and it's been packaged up in a box with a bow on it, sent through detoxification. Once it hits your intestines, it's supposed to go out. It's supposed to go all the way out, into the toilet and beyond. But the estrobolome, if it's dysfunctional, if it's got problems, what it will do is it will untie the bow and lift off the lid, and that estrogen will get reabsorbed back into the body. So some men and women actually have estrogen problems not because of how they produce it, but because of their intestinal health, and it's causing it to get reabsorbed. So it's really, really important when we look at how you clear your estrogen out of your body.
Hmm. So some of the conditions that would have potential dysfunctions with the estrobolome are what? Like, I know one of them's like endometriosis is
Mhm.
one. What are some of the others?
Yeah, endometriosis is definitely a big one. Anything that's sort of that estrogen dominant state, so PMS, weight gain, heavy periods, fibroids, polyps, um, Pilates periods, breast tenderness, breast enlargement, anything sort of breast related as it relates to estrogen, all of that can really be affected by the gut, by this estrobolome.
Gotcha. Okay. So you talk a lot about detoxification of estrogen. I guess this is a key part of that. When we're looking at the strobolome and the gut's role in detoxification. Um, can you just take us through just some basics of like phase one, phase two? I think you were the first one to talk to me about phase 2.5 and also phase three detoxification, which I did not learn about in naturopathic school. That was not even mentioned, even though I'm getting up there in age. That wasn't too long ago.
Yeah, it's and I don't think they actually just put. I mean, we learned like it goes to the liver and then it goes through the kidneys or the intestines and out it goes. But so it's only kind of recently that we've labeled them as phases. And honestly, phase 2.5, full credit goes to Dr. Kelly Halderman, who's an MD, and she sort of started calling it that, and I thought, man, that's brilliant. So phase one, so when you go through detox, you go through these essentially three phases. So when you have a chemical, a medication, a hormone, anything in the whole body, phase one is where you go through the liver, and it's where you convert your estrogen into what we call a metabolite. So basically, it's taking your estrogen and presto changeo, converting it into a metabolite so it can continue down through the detoxification pathway. Now, the problem with phase one is that some of the pathways in there, some of your options are cancerous, and some of your options cause things to grow, so that's not good. And then one of your options, we consider it like the less cancerous. It's kind of like the better of the options. And so when we're looking at women in estrogen, I want to make sure she's going down the less cancerous pathway, the less cancerous option. I don't want her to increase her risk for breast cancer, and I don't want her to have to grow things like heavy, heavy periods, clots, fibroids, what have you. So it's important that the phase one is sort of directed the right way. Then it goes through phase two, and phase two is where you take that metabolite and you essentially what we call neutralize it. So you make it so it can't hurt anything, so it can't do much. It's not going to backfire on the body. And so phase two uses an enzyme known as, it's called COMT. And COMT is basically the enzyme that helps to neutralize it, like puts the fire out. And so by knowing how your enzyme is functioning, your COMT, and by knowing some of the cofactors that go with it, like magnesium, which is a big one, and some of the B vitamins and other things, that can be really helpful for estrogen detox. Now, once you do that, you have to move it from inside the cell, whatever in the cell, usually it's in the liver, so the cell in the liver, and you have to get it out. You have to get it out into circulation so that it can go to the kidneys or it can go into the bile and then on into the intestines. So phase 2.5, Dr. Halderman said, that's actually the ability to get from inside the cell to outside the cell. It's a whole process to get in to out so that it can go to where it needs to go. And a lot of times we talk about bile health and gallbladder health here. Excuse me. And so by understanding how your bile health is, how your gallbladder is, and a lot of women don't have gallbladders. A lot of women have had their gallbladder removed, and therefore they struggle with hormones as a result. And then lastly, phase three is just what we talked about with the estrobolome. It's basically how well do you have a bowel movement? Do you poop every day, and can you get that estrogen out, or do you struggle with gas and bloating and constipation and candida or maybe parasites? And so it sounds rather complex with all these different phases of estrogen, but the body is smart, the body is intelligent, and puts it on a path so it can go from doing it active and on and doing its job all the way to the end to where it's inactive and ready to be excreted in a healthy manner.
Well, thanks for walking us through that. I want to just mention that that's like at least a 4-hour course in itself that you made a synopsis out of. There's a lot to learn, and that was really good to kind of set up the structure. So, for someone who's thinking about this problem, what would they typically see on like a lab test when there's disruptions in this process or estrogen clearing?
Oh, that's such a good question. And it's important for people to know too that I will often have the question, well, I have PMS, so where is my detox problem? Like, I don't know. That's a really good question. It could be phase one, it could be phase two, it could be phase three, it could be all of them, two of them. So on traditional lab testing, as an example, women will say, I got my blood drawn and I was told I'm estrogen dominant. I have more estrogen than progesterone. So what phase is that? I'm like, well, that estrogen, just looking at estrogen is just exactly what you think it is. It's just looking at estrogen, and the active one is called estradiol. And so by just knowing that level, it doesn't tell us anything about your detoxification. In order to look at specifically phase one and phase two, which is usually in the liver, we look at urine testing, believe it or not. So patients will urinate on, like strip of paper, or they'll do a 24-hour urine, and they will see what their phase one and what their phase two is doing. And then the phase three is done in stool testing. So I'll say, okay, now we have to poop in a cup for science because I need to evaluate what the estrobolome is doing. I need to look at a marker specifically known as beta glucuronidase, which is a big word, but that's the enzyme that affects estrogen in the intestines. And so it can be, looking at this whole thing can be kind of comprehensive, for some men and women. They get a little bit overwhelmed because they're like, well, that's a lot of testing. Like, can be a lot of testing, but wow, we get a lot of data points, and we get a lot of information to make what to do a lot more personalized.
Hmm. Yeah. So, I want to get into beta glucuronidase in a second here because that's such an important marker for um, estrogen dysfunction. And just kind of backing out a little bit, what kind of basic symptoms in the gut would someone see with estrogen dysfunction? Do we see like more constipation, more bloating, or is that just sort of normal kind of behavior of estrogen throughout a cycle?
Honestly, constipation's a big one. If a woman or man says that they don't have a bowel movement every day, they're more on the constipated side, and they have all the estrogen symptoms, then I start to think it's probably something going on with the estrobolome. Now, other symptoms can be included here, just like you said, bloating, gas, just upset stomach, even a history. Sometimes when men or women say, I have a history of parasites, I have a history of candida, and I feel like those symptoms are coming back. And that may be the cause and the reason for the bloating and constipation, but the fallout is that those then result in higher estrogen. So having candida, or having a parasite, having a worm, or maybe eating foods all the time that you shouldn't, maybe dairy's constipating to you. We know the constipation is due to the dairy, as an example, but the end result is it's going to ultimately affect your estrogen.
Gotcha. Okay. So, let's say that there's symptoms of estrogen dysfunction and we're starting to see this on the analytes in the urine test, that there may be some dysfunction in clearance, and you get a stool test back with beta glucuronidase high.
Hmm.
Um, what's that tell you about what's going on in the gut, and what does that mean?
So it's an enzyme. So beta glucuronidase is specifically the thing in the estrobolome that we look at. It's specifically the enzyme, as I was saying earlier, that will untie the bow and take off the lid and allow estrogen to fly free. So the higher your beta glucuronidase, the more bows and packages that are getting untied and opened up, and the more estrogen that's floating around. Now, beta glucuronidase isn't all bad. That's the next question I usually get. Like, oh, do I want it to be zero? You don't. It's really important for other digestive purposes, but it's kind of like Goldilocks. We want not too much and not too little. It has to be just right. So when it's high, then we tend to see high estrogen symptoms.
Hmm. And for the listeners, we're not going to go on this too much, but just if you could just comment, there's a lot of things you can do for high beta glucuronidase. I mean,
Yeah.
this isn't just like you find it and you say, "Oh well." I mean, there's a lot of action steps, right?
Yeah, I mean, even just simple things like getting more pre and probiotics and adding more fiber into your diet. As you know, most people don't get enough fiber in their diet, and if they're struggling with constipation, and they're dehydrated and low fiber, just that's step one and step two. Get the bowels moving, and that can help.
Hmm. Hmm. And the beta glucuronidase is usually connected with, from my understanding, like a dysbiosis or
Hmm.
some kind of imbalance of the gut flora.
Yep.
Um, is that something that usually when you address that, does beta glucuronidase improve?
Yes. Yeah. Especially, and that's why I like doing that's why I like doing testing. I want to know specifically what might be causing it to be imbalanced versus just thinking, oh, I have estrogen problems. I'm going to, I'm just going to try fiber. Well, fiber's great. And like I said, it's like that and hydration are like number one and number two. Fiber and water are not going to get rid of a worm. They're not going to get rid of,
Yeah.
if you've got giardia or, candida, or if you're eating fried food all the time. And so that you've got this microbiome that's, kind of geared towards the unhealthy. And so, or alcohol will completely affect your microbiome. And if you're drinking 2 glasses of wine every night, can understand why you have gut issues. It goes hand in hand.
hmm And also, there's been some information about long-term use of oral contraceptives.
Mhm.
Is that still
Mhm. Yes. Yeah. And women will say that. They'll say, I've been on the birth control pill for 10 years and not even realizing they're connected. And they'll go, oh, and by the way, I've had gut issues, for 10 years.
yeah? One of the interesting things that I learned from you, or you actually helped me connect some dots on, is how beta glucuronidase is not just kind of mobilizing the estrogens that you're trying to eliminate, but it's also can be reabsorbing the estrogens you're trying to eliminate. It also could be reabsorbing xenobiotics and
Hmm.
other estrogen-like materials from the environment that are passing through your gut.
And I don't think, yeah, a lot of people don't realize that. Like if you drink out of a hot plastic water bottle, as an example, if you're using skincare products that are full of chemicals and they can act estrogen like, if you're putting fertilizer in your yard, in your garden, and you're breathing it in or getting it on your hands and it's acting estrogen like, your body still has to run that through detoxification. And again,
Mhm.
in the same way, if your beta glucuronidase is high, it's going to affect the reabsorption back into circulation.
Mhm. So when the estrogen gets back in the body, does it look exactly like estradiol that came out, or
Yes.
does it have some modification?
Nope.
Okay.
Nope. That'd be really nice. We would appreciate it on lab testing if it would be like specially tagged and we
Yeah.
could tell the difference. But nope, it looks just the same as it was when it was created out of the ovaries, as an example.
Okay. Okay. Wow. So, are there hormones that may be influenced by gut health, or is there any others that you think of that have some research behind them?
Yeah, actually all the hormones are really greatly affected by gut health. So any inflammation in the gut, of course, is going to affect cortisol, which is our stress hormone. And then, just inflammation in general can affect progesterone. It can affect how a woman ovulates. And when it's after ovulation, once she releases that egg, that's when she makes progesterone. We do make hormones. There are um, you know, uh, microbes that make hormones in the gut. So you could be skewed to having a microbiome that does make, a little bit more hormone or a little bit less hormone. And so the gut has a huge role in feedback loops and in how the body handles hormones.
Okay. And so you've already talked a lot about this, but you're sort of overseeing the Dutch test, and what would be kind of the general flow if someone has estrogen problems? Like, how would they go about this? Would they first do the Dutch test, or first do gut testing, or does it not matter?
So that's a great question. It depends if you want to see start to finish, then you would do the Dutch test, which Dutch is an acronym, stands for dried urine test for comprehensive hormones. But we are not a stool test. We are a urine test. So we look at phase one and phase two, and therefore this stool test would be phase three. Now, when we address imbalances, we so I teach it as 1, 2, 3, so you understand the flow, but you address it as 3, 2, 1, right? Because if you have constipation, I can do anything in the whole world to your liver, but if you can't poop it out, then it's going to be problematic. You're just going to reabsorb it. And so for some people where gut is their biggest complaint, if gut is you've constipation, gas, bloating, whatever, then start there. Just get the stool test and start there and then work backwards.
hmm And there's other tiers to this. I mean, I think as we get into understanding estrogen problems, cleaning up the gut and then
Mhm.
also cleaning up your environment,
Mm,
right? I mean, you know,
100%. Yeah. Why add? Why use chemical fresheners and skincare products and, gardening stuff or whatever maybe your hobby includes chemicals. Like just be aware what you clean your house with and what do you live around? Do you live near a paper mill? Are you living by an airport? Like all, then look at your air quality. So it does require reading labels and being proactive. Even like I said earlier, alcohol. I have women that say, well, I have glass or two of wine every night. And also, but they have a lot of estrogen issues. I'm like, unfortunately, I think that alcohol is really compounding your estrogen issues. I think you need to cut back. That's going to affect the way you detox.
mhm. Okay. Well, there's a couple more questions, and that I haven't just, and I could talk to you for a long time on this, but one of the questions that comes up a lot, when people get their Dutch test back is like, you know, if there's estrogen issues in the luteal phase, is that, I mean, if we're seeing higher estrogen comparatively in the luteal phase, which is the second phase of the cycle. Is that sort of what flags for problems with clearance of estrogen?
At the time of testing, yes, at the time of testing. So when you do any test, so like any urine test, but Dutch testing in the luteal phase, then that's what it's evaluating that estrogen on that day in that phase, and you can see what's going on.
Okay, so it gives you the snapshot of
Yes,
when that dysfunction would largely appear. So,
correct. Correct.
okay,
Yeah.
great. Any kind of future areas that you're looking at in this arena that maybe you're thinking about or researching?
So when it comes to the Dutch in particular, yes, we always have all sorts of R&D going on. So we're looking at some additional organic acids. We're actually looking at some additional ways to test cortisol because cortisol can really impact, so many things when it comes to hormones. And we as a company are not looking at going into stool testing, but I do know that there are some really great stool testing companies out there, and their research and development is really, really cool and what they're looking at for the microbiome. So I'm excited to see how really all the lab companies are continuing to grow and explore and research, so we can continue to put all this together and so we can continue to help men and women when they struggle with estrogen issues, estrogen symptoms, estrogen conditions, reducing things like estrogen related cancers. Like, like how great if we can just continue to improve upon these, detoxification processes and reduce risk, reduce symptoms.
Yeah, and I think your work also ties really well in with nutrigenomics, and you talk a lot about like the genes that are involved and how we can influence and support genetics. So, I I always like to people to know that when you get these results back, especially working with you, I mean the Dutch test analysis is just so thorough, and it gives you such great insight and ideas about what you can do versus just kind of coming back with data with no actionable steps.
Right. And that's what I like about estrogen detoxification is that it's not something that you have to just suck it up and deal with. Like it's so
Yeah,
actionable. There are so many things you can do, and it doesn't have to cost a lot of money. I will have women that will say, "Well, how much is this going to cost me to improve my detoxification?" I'm like, "Well, actually, if we let's start with the gut. Like let's work backwards, and there's so much we can do from diet and lifestyle and hydration and you know, choices first. Supplements are great. There are a lot of supplements that can be very helpful, but women can and men can really be proactive and get things moving again.
hmm okay. Well, you've been just wonderful to speak with, and As always, you share such good insight, and I'd love if you could leave us with some take-home messages about this, and it's also just kind of leave us with some information about how to follow your work or anything that you're working on that you want to share with our audience.
Yeah, you can follow me on Instagram. That's where I hang
Mhm.
out quite a bit.
Yeah,
It's
yeah.
it's at my handle is at Carrie Jones, and I do work, as you said, I'm the medical director for Dutch, so full disclaimer. However, all of my posts are education. My whole goal is to empower women to understand hormones, even the hard stuff, so that they can go and talk to their doctor and their practitioner about it, understand what's going on. So that's where I tend to
Hmm.
hang out. And then honestly, the take home message is to test, don't guess. Don't just just don't just assume, oh, I read about this one, this product. I read this estrogen product online. I'm going to take it, because the number of women that write me and say, so I didn't test, and I saw an ad on Instagram, and I bought the product, and I feel worse. I'm like,
Hmm.
I don't think that's the
Yeah.
product for you. That's why testing is helpful. So that I don't want you to waste your money. I want to be really specific when it comes to detoxification, and it's detoxification. So I don't want you to screw it up. Meaning, I did right. I don't want you, when we think estrogen, this show is about estrogen, but we forget that everything goes through the liver. So just because you're speeding up or slowing down something around estrogen, it 100% means you're going to speed up or slow down around every other chemical and medication you're taking or around or
Hmm.
exposed to. So
Hmm.
it doesn't work. There's no silo, there's no independent lane for estrogen. It gets funneled in with everything else. So just keep that in mind when you're trying to manipulate the liver.
Hmm. That's excellent knowledge and suggestion. Thank you so much. Well, we really appreciate your time. I know you've got to run here, and you've been very generous, and we'll continue to learn for you and hope to continue to.
Oh, most definitely. Thanks. Yeah, I appreciate it.
Thank you so much for tuning in to this week's episode of the One Thing Podcast. Please share these episodes with your friends, loved ones, colleagues, patients, healthcare providers, anyone who you feel might benefit from hearing these informative interviews. We tend to learn best from people sharing things with us. That's often the first time it's introduced. So don't hesitate if the content of these episodes reminded you of someone that might benefit from it. Forward the episode to them, and I'm sure they'll either appreciate it or be appreciative that you've thought of them. So once again, we'll look forward to seeing you next episode on the One Thing Podcast. And again, much appreciation for you being here with me.